Erectile dysfunction can have a range of causes. Your doctor may perform a variety of tests to diagnose the illness and discover the cause. It is only after determining the cause of erectile dysfunction that it may be adequately treated. Your doctor will review your medical history and do a thorough physical examination before ordering any test. In addition, the doctor will conduct an interview with you regarding your personal and sexual history. Some of these enquiries will be extremely personal and may feel intrusive. It is critical, however, that you answer these questions truthfully. The following are examples of possible questions. One, what drugs or medication are you currently taking? Prescription medications, over-the-counter drugs, herbals, dietary supplements, and illegal drugs all fall into this category. 2. Have you ever dealt with psychological issues like stress, worry, or depression? 3. When did you first notice symptoms of erectile dysfunction? 4. What has been the frequency, quality, and length of any erections you've had? 5. What were the precise conditions that led to the onset of erectile dysfunction? 6. Do or did you experience erections at night or during the morning? 7. What kind of sexual tactics do you employ? 8. Is your current relationship having issues? The doctor may also want to ask questions of your partner because he or she may know more about the underlying problems. Your doctor may request one of the following tests to further assess your issue after your physical examination and discussion. Complete blood count. This is a group of blood tests that can be used to identify anemia, among other things. Anemia is characterized by a low red blood cell count, which can result in fatigue, which can lead to erectile dysfunction. Liver and kidney function test. These blood tests might reveal whether your erectile dysfunction is caused by a problem with your kidneys or liver. Lipid profile. This blood test determines the amount of lipids, that's fats in the body, such as cholesterol. Atherosclerosis, that's hardening of the arteries, can impede blood circulation in the penis. Therefore, high levels may indicate this. Thyroid function test. One of the tasks of thyroid hormones is to regulate the synthesis of sex hormones, and a lack of these hormones can cause or contribute to erectile dysfunction. Blood hormone studies. Testosterone and or prolactin levels in the blood might be checked to discover if there are any anomalies in these sex hormones. Urinalysis. Urine analysis can reveal a lot of information, including amount of protein, sugar, and testosterone. Diabetes, kidney illness, or a testosterone deficit, all of which can induce erectile dysfunction, might be indicated by abnormal readings of these chemicals. Duplex ultrasound. This is possibly the most effective test for evaluating erectile dysfunction. Ultrasound takes photos of the body's tissues using high-frequency sound waves. An ultrasound may be used to assess blood flow and look for symptoms of a venous leak, atherosclerosis, that is hardening of the arteries, or tissue scarring in persons with erectile dysfunction. This test is done both while the penis is erect, which is usually caused by an injection of an erection-inducing medication, and while it is soft. Bulbocavernosus reflex. This test examines perineal nerve feeling. During the test, your doctor will compress the head of your penis, causing your anus to contract immediately. There will be a delay in response time if nerve function is impaired. Nocturnal perineal tumescence. This test is used to determine a man's erectile function while he is asleep. A man usually has 5 or 6 erections while asleep. A lack of these erections could suggest a problem with nerve function or perineal circulation. The snap gauge method and the strain gauge method are both used in this test. Wrap 3 plastic bands of various strength around the penis to perform the snap gauge procedure. The erectile function is then assessed by determining which of the 3 bands has broken. Placing elastic bands around the tip and base of the penis is how the strain gauge method works. The bands stretch if the penis becomes erect during the night, monitoring changes in perineal circumference. Biotensiometry. Electromagnetic vibrations are used in this test to measure sensitivity and nerve function. Nerve injury may be indicated by diminished sensitivity to these vibrations. Vasoactive injection. During this test, specific solutions are injected into the penis to cause the blood arteries to dilate, thus enlarge, allowing blood to enter. Dynamic infusion cavanosometry. This test is done to see if a man has erectile dysfunction and a venous leak. Fluid is poured into the penis at a predefined rate during this test. Doctors can estimate the degree of a venous leak by evaluating the rate at which fluid must be pumped to get a hard erection. Cavanosography. This test includes injecting a dye into the penis and is used in conjunction with dynamic infusion cavanosometry. The venous leak is then visible on an X-ray of the penis. Arteriography. People who are candidates for vascular reconstruction surgery are given this test. X-rays will be taken when a dye is injected into the artery that is suspected of being damaged. Your doctor will explain what each of these tests entails before you undergo them. Please do not hesitate to ask your doctor any questions you may have. Thank you for watching, and don't forget to subscribe to this channel. Like, comment on the video, and also share.